Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about something that has a Latin name called plantar fasciitis, one of the most common causes of heel pain in adults. If you have ever awakened with a stabbing pain in your heel during those first few steps of the morning, you may already be familiar with it. Joining me today is my friend and colleague, Dr. Bryn Henderson, a board-certified physician and expert in regenerative and musculoskeletal medicine. We couldn't have anyone better for this disease. Thank you, Dr. Henderson, for being here.
Well, and thank you for the compliment. My privilege.
Dr. Henderson, what exactly is plantar fasciitis?
Plantar fasciitis is an inflammatory disorder, and it degenerates the tendon at the base of the foot. A thick band of connective tissue runs along the bottom of the foot. It connects the heel bone to the toes. Its main role is to support the arch and absorb shock during walking and running. When it's overused or strained, there's tiny tears can develop and cause pain and stiffness.
Can genetics play a role in plantar fasciitis?
Well, plantar fasciitis is mostly mechanical. There's some evidence that connective tissue structure of the foot, especially the arch, and the collagen composition there can be influenced by genetics. It may increase your susceptibility.
So let's talk early development. Do factors happen before birth?
Oh, yes, they do. Plantar fasciitis forms from the soft connective tissue in the fetus. The way the bones, tendons, and ligaments in the foot develop before birth can affect foot shape and movement, which may put more stress on the fascia later in life.
What are the main risk factors for plantar fasciitis?
The major risk factor for sure is repetitive impact from running or standing for long periods, wearing unsupportive shoes, obesity, having flat feet, and very high arches or tight calf muscles. All can increase the risk. It's also common in people between 40 and 60 years old, believe it or not.
Well, wait a minute. You're saying flat feet, and then you're saying high arches. So are you talking about the extremes of the shape of a foot?
That's true. And it could happen in either because of the proclivity of different activities to aggravate the tendon as it comes across the base of the foot.
All right. So how do symptoms typically present in your office?
The classical sign is sharp heel pain, especially during the first steps in the morning or getting up from a chair after sitting a long time. The pain often eases as you move around, but can return after prolonged standing or activity.
How do you diagnose plantar fasciitis?
Plantar fasciitis is a diagnosis that's usually clinical. It's based on symptom, physical exam, and it's real easy to see on an ultrasound. Pressing the heel or stretching the plantar fascia can reproduce the pain. Images like the ultrasound, and in rare cases an MRI, are used if they don't improve to rule out other causes.
What do you see on the ultrasound?
The ultrasound looks as a band, so the tendon itself gets thicker, and it shows indications of inflammation and swelling.
All right, let's talk a standard of care in the United States of America for treating this.
I think the standard of care is conservative. Most people use stretching exercises. One of the things you see very commonly with the various types of therapists, kinesiologists and physical therapists, is the stretching exercises. And they often put water in a plastic bottle, freeze it, and have them rub that under base of their foot to give them relief because the cold gives pain relief.
Wait a minute. So a person at home could take a bottle of water, put it in the freezer, bring it out,
Put it
on the floor and rub their heel on it?
Yeah, and the whole foot.
Oh,
It's really cool. So conservative care works best. The stretching exercises that you're given by your therapist or physician, no, absolutely nail it. The supportive footwear also helps. Orthotics inserts are rarely, but when you need them, they're a blessing. Activity modification, don't continue to aggravate this. Anti-inflammatory medications, especially if they're topicals, are very effective.
all right, let's talk traditional Chinese medicine. What's their approach to plantar fasciitis?
Yeah, that's fun. TCM on heel pain says it's associated with both the kidney and the bladder meridians because TCM is all about balance. So the meridians that are out of balance are reflected in the blockage of blood in the foot. Acupuncture, herbal patches, and massage are often used to reduce inflammation and definitely improve circulation.
So when you talk massage, are you talking about the calf? Would that help?
Absolutely. You start where it originates. The tendons in the foot nearly all originate in the calf. So what you're pointing out is absolutely true, but mostly on the backside where the gastrocnemius muscle is, and you can get all kinds of good relief by increasing that circulation because everything yields in proportion to its circulation.
Well, let's talk about your area of expertise, regenerative medicine.
Well, we've had very encouraging results with PRP. Platelet-rich plasma delivers growth factors, healing factors, and all kinds of new vessels into the areas of damage. There's also shock wave therapy that is extracorporeal, meaning outside the body, and it's another option that promotes tissue regeneration if need be.
Wonderful. All right. What can patients do at home?
Well, probably the first thing they can do is what we were talking about with the frozen water stopping the pain. But they can stretch those calf muscles. They can roll the arch over a cold can or massage ball or a bottle of water. And wearing supportive shoes are extremely important. Even indoors can help. Maintaining a healthy weight, that means not overweight, and avoid barefoot walking on hard surfaces are also important because it supports the arch.
So what's the prognosis for people with chronic plantar fasciitis?
Most cases, it can be resolved in months to a year. Chronic cases, however, have high risk factors that are rarely addressed. You have to really get into the regenerative treatments that give them a good solution and offer them hope.
All right, let's do your mnemonic for plantar fasciitis care.
It's a good one. It's heel fast.
H stands for?
Heel support with cushioned shoes or orthotics.
E.
Exercise stretches for calf and fascia.
A.
Avoid barefoot walking on hard floors.
L.
Low impact activity while healing.
F.
Foot massage or rolling therapies.
A.
Apply ice for pain relief.
S.
Strengthen the foot and the ankle muscles.
T.
Treat with regenerative options if it persists.
Well, thank you, Dr. Henderson, for explaining plantar fasciitis and the wide range of ways that we can treat it, from home care to advanced regenerative techniques. If you are experiencing heel pain, do not ignore it. The sooner you start treatment, the faster you'll get back on your feet. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.